My name is Beth McNulty. I'm an assistant professor in the Department of Otolaryngology, Head and Neck Surgery. I'm actually a neurotologist, so I specialize in pediatric and adult hearing loss, tinnitus, dizziness and imbalance, chronic ear infections, and skull-base tumors ranging from cholesteatoma to acoustic neuromas. I see children and adults. I see fairly healthy patients, fairly sick patients, basic problems like fluid behind the eardrum that won't go away that I can fix pretty simply by placing an ear tube, to really complex problems like skull-base tumors that require dissection of the facial nerve and other cranial nerve monitoring. Sometimes I do those procedures with neurosurgery. The tumors that I treat, I can treat surgically, but I'm also trained to treat those with radiation. So it's a wide breadth from very simple problems to very complex, and I love that. One of the reasons why I wanted to come to the University of Kentucky is because I knew that at a tertiary referral center, a big academic center like this, I would be presented with some of the most challenging cases that would push me to be my best. Working with the residents, I think, is a real strength of my practice because they're always asking questions. And that requires me to be on my A game every day. I have to know the latest literature and the latest procedures and technologies that are available for my patients, with the residents kind of challenging me. So I think the academic part of this is what pushes me to be the best physician that I can be. The reason I chose this specialty dates back to medical school. I remember specifically the patient, the first time that I experienced the restoration of hearing and the magic. It was a lady who'd been basically deaf on one side for about 20 years due to scarring of the ear canal, and she was trying on a bone-anchored hearing aid. And with that restoration of hearing, with that device, immediately, tears came to her eyes. And it was really moving for everybody in the room. And I knew then that that's what I wanted to do. I wanted to work with patients who had a loss of a sense like hearing, and to be able to bring that back through surgeries such as a bone-anchored hearing aid or a cochlear implant. So that scenario specifically is kind of what did it for me. I think one of my strengths as a physician is that I'm able to listen and relate to my patients. And I think being a Kentucky native gives me a certain advantage to our patient population for sure. But I strive to give 110% to every patient every day. And I try to step back when I'm counseling patients and think, how would I treat my mother? How would I treat my child? What would I want? What do I think would be best for them? And I try to bring that to every patient encounter. I think that's really my strength.